Let's start. Hello, ladies and gentlemen. Thank you very much for joining me today in my live podcast here from Central Texas. And today's subject is why a medical label for your health condition is not necessary. I see this on a daily basis where the people contact me, my future patients, and they have a medical label for their disease. Sometimes it's very rare and I've never heard of it. And they tell me even many doctors have never heard of it. And once they hear that medical label, this usually long word like fibromyalgia, which a lot of people can't pronounce. I can't spell it. But, it's very misleading, that label. And then then they become panicky and worried because they've got some rare medical condition that nobody's ever heard of. And that's, because it's been labeled with that label. And it's really irrelevant, this medical name for, practical treatment purposes. The name, of course, that it communicates to me what your health issue is or what the doctor perceives your health issue as, because I can then interpret the label backwards. For example, ADHD. This is a terrible label that they give to children and people who are unable to focus. And I really hate these labels. Particularly for mental conditions, these labels, I think, are very confusing to the patient. They don't help in any manner. And it makes you feel like you've got some rare disease when you have ADHD, when in fact, you're probably just drinking too much coffee, having too much sugar, and your mind's overstimulated and you can't focus. It's really quite simple. The other type of case is where the people continue to go to testing, and the doctor isn't sure why they have the pain, why they have the inflammation, why they have the stomach pain, why their liver's bothering them, why they have gas and bloating, and they continue to do colonoscopies and endoscopy and ultrasounds and MRIs and blood tests and fecal tests and urine tests, and then nobody can get a label for it. Now, this also is very discouraging and completely useless for the client, because now they think, well, they're uncurable because nobody's got a medical label for what they have. So in both of these cases where you have a label for your condition and then you think you have a disease, it makes you concerned. And then when they cannot find a label for your condition, then you're even more concerned. But what I'm here to tell you today is it really doesn't matter if they find a label or what the label is. It's really irrelevant when it comes to treatment, because these are medical terms, and many of them are not related to or not helping you to understand your condition. Now I'm going to give you a long string of examples, like the one I said earlier, fibromyalgia. Okay, so let's break it down into these three areas. One, it's our body can only be seen in terms of not muscles, but systems and organs. You got all the different organs in the body. We can count the brain as an organ. We can count the reproductive system as a couple organs down there for women, and a little bit simpler for men. But these are still organs. And there's systems involved with every organ: reproductive system, circulatory system, cardiovascular system, respiratory system, and then autoimmune. And then we've got immune system. We've got all these, and each system can have different organs involved: digestive system, eliminating system. So the first thing to do when you have any health issues, don't worry about the medical label. Look at what system and what organ is involved. Okay, we take a look at, so you got pain down here, and we know that's the colon. Basic anatomy, is colon. You got a little blood coming out of your colon, so it's a problem with the colon. So, 2, what is the imbalance or the problem? What's happening? First, where? And then what? Well, in this case, if you have pain in your colon, And then it can be, puncture, or it could be a tumor, but in most cases, it's going to be inflammation in the colon. So you can get a lot of fancy names for that. IBS, IBD, ulcerative colitis if there's blood. And sometimes they're not even sure whether you're IBS or IBD, or, sometimes a little blood. So sometimes you're ulcerative colitis. And sometimes they give even different names for these inflammatory colon conditions. But what is it? It's inflammation. That's what it is. And where is it? In the colon. So it's called inflammation of the colon. So that's why you look at the products that we sell in my private practice, and many of these are available on our website, who's sponsoring this, Herban Teas, herbanteas.com. All the products I show you today will be available on that site, Herban Teas. The products will not use the medical term. Here we call it Healing Gut Formula. Healing Gut Formula. Now, there are two versions of this Healing Gut Formula, but what is it for? Inflammation of the colon with many loose stools. So this could be IBS, this could be leaky gut, this could be ulcerative colitis. Now, there's two versions of this Healing Gut Formula. One is you have constipation and loose and diarrhea kind of mixed together. The other one is you just got a lot of diarrhea. So there's different versions. So that's the third thing you need to look at. One, where is it? Two, what's taken place? And three, in Ayurveda, we'd saw whether it's vata, pitta, or kapha. So we could say, is it depleted and dry like vata? Or is it clogged and congestive and blocked like kapha? Or is it inflamed and red and burning and bleeding like pitta? So, we can look at vata, pitta, kapha just like we would gardening. When you garden, you still have to deal with the three doshas, vata, pitta, kapha. What is pitta? The sun. Too much sun, the plants burn. Not enough sun, they don't grow. It's the same with pitta. And the earth and the water, that's the kapha. You have to have the right nutrients, you have to have the right water. And then vata is the air, the space. All plants need space to grow. If they don't have enough space, they're not going to grow. And of course, they're consuming carbon monoxide. So that's the three aspects right there, even looking at plants, the vata, pitta, kapha, the sun, the earth, the air, basically. So in this case, if you've got inflammation and burning sensation and pain, that's pitta. So there's heat involved. Heat is pitta. So these are the three categories we need to use to diagnose your condition. First is where, colon. What? Inflamed. Two, is it vata, pitta, kapha, or what's happening down there? Is there heat, or is there dryness? Is there blockage? These all need to be, and these are all mostly symptoms that you can see from asking the patient. And then you treat that. We're not treating IBS. We're not treating irritable bowel. We're not treating ulcerative colitis. We're treating inflammation in the colon. Okay? Let me give you some more examples. We'll stick with inflammation. Okay, now, and another fancy label that can scare a lot of women: endometriosis. Oh my God, what's endometriosis? What is it? Well, we know it's in the uterus. And what is it? Well, we know it's inflammation. So there we go. Again, we've got inflammation in the uterus. Again, it can create excess bleeding. And we do have two types, one where there's a lot of bleeding and burning sensation, and one where there's not. So you look at the formula provided, and it is called, it's not called endometriosis. It's called Ayurvedic uterine anti-inflammatory formula. And this is used also for fibroids. So it's used for excess menstrual bleeding, fibroids, ovarian cysts, painful periods, basically, and endometriosis. Because all those conditions, even the fibroid, is creating inflammation. All we would do is combine it with another T that's for the fibroids, but the fibroid could be creating the inflammation, but we need to bring the inflammation down. And that's what this formula does, is bring the inflammation down in the uterus. There's another formula tea called fibroid tea to help to actually reduce the size of the fibroid. I can give you more examples. All right. Well, neuropathy, another big word, hard to spell, scary word, but what is it at the end of the day? Nerve pain. That's right, nerve pain. You got nerve pain, basically. Where is it? The nerves. What's going on? Pain. And there can be different types too. You can have burning nerve pain, and you can have kind of like just kind of numbness nerve pain, and you can even have neuropathy, so to speak, without the pain. But so this is also can be used for sciatica. Now, of course, sciatica, we're having the spine is pinching the nerves, so this is another factor. And you have to do like a spinal decompression, some yoga to spread out the spine because the cause is the pinching. But the actual pain, this is basically a nerve pain formula. So whether you have neuropathy, sciatica, or even like in case of like a herpes, you can have a inflammation in the nerves due to infection. Again, you may have to take other formulas as well. You may have to take something for the infection. In that case, if you have an infection like herpes that's on the nerves, that you may have to take a herb for the infection, but to get rid of the pain, it's the same formula as the sciatic pain. It's the same formula as the neuropathy pain because the herbs are not treating a medical condition. They're having an action. In this case, they're reducing pain and inflammation in the nervous system. That's what they're doing. The formulas are complicated. So now if you say, looking at, again, the nervous system, now what happens when your nervous system is damaged? Well, then you can get some fancy conditions like multiple sclerosis. You can get Parkinson's. But what has happened? The myelin sheath has been damaged in the nerve. The cell of the nerve has been damaged. So, what are your symptoms? Are like trembling, numbness, some burning pain. But basically, it's Parkinson's and multiple sclerosis are using the formula Ayurvedic nerve damage tonic. Tonic means it's building and strengthening. And it says for trembling, tingling, burning nerve pain, damaged nerves caused by infection, and even autoimmune conditions, and some advanced cases of neuropathy. Now, you really have to know these formulas well because you can see there's a lot of herbs that are overlapped. The difference between this one and the nerve pain one, the nerve pain one has more analgesic herbs for the pain. Well, this one has more healing and restorative herbs. That's why it's called tonic. But basically, you're getting the idea. We don't use these words like diabetes. No, that's a medical term. Was what's really wrong. You're having, of course, insulin resistance, but basically you're having a blood sugar management problem. So you need to manage your blood sugar. So, we have blood sugar balance tea. This is helping to manage your blood sugar. And unlike medication, it won't force your blood sugar down too much. It only will help it to manage it, to help it to stabilize. And what is it really treating? It's not really treating your blood. It's treating your pancreas and helping with the metabolic process of insulin resistance. We're not treating disease. We're treating the system, in this case, including the organ, the pancreas, plus the system, the metabolic system that's called insulin resistance. Even for high blood pressure, we don't use hypertension. We use healthy heart or healthy circulation, and this is supports a healthy blood pressure. And we're not going to go into all the herbs because our point today is to help you to understand your own health condition from this very pragmatic and easy to understand approach. And of course, in Ayurveda, there's 3 levels to treatment for every health condition. We'll go back to the nerves. First, there's always, when we make these formulas, there's some herbs. If it's in a nervous system, it doesn't matter what it is. ADHD, neuropathy, nerve pain, that's all the nervous system. Even the mind is greatly supported by the nervous system. If the nervous system's overstimulated, the mind is going to be affected. In Ayurveda, they say that the mind is being held by the nervous system, carried by the nerve. So whatever happens to the nervous system, the mind is going to react. So if your nervous system is overly stimulated because you're drinking coffee all day long, then your mind is going to be overstimulated all day long. And this is going to contribute to anxiety, overthinking, insomnia, ADHD, and all types of mental imbalances, all coming from the nervous system. So in all of these cases, you're treating the nervous system. It doesn't matter whether it's ADHD, insomnia, or nerve pain. You're still in the nervous system. So some of the herbs in all those formulas for all those conditions are going to be the same. In this case, ashwagandha, vidarikan, these are, jadamadsi, shangpushpi. These are all herbs for the tagar. These are all Western herbs, passion flower, skullcap, catnip. These are all herbs for the oat straw. These are all herbs for the nervous system. And they're going to be the base of the formula. You don't take an herb for your nerve pain. No, the first thing you do is you're taking herbs for your nervous system. And then second part of the formula, we're talking breaking down the formula or the trip. Some of the treatment, some of the herbs are different herbs can be for that nervous system. Then other herbs can be for the condition of the nervous system. What is wrong with the nervous system? Is it overstimulated, as in anxiety, overthinking, insomnia? Is it in pain? Or is it just dull and no effect? Like your mind is dull and depressed, and you're not sensitive, you don't have any feelings, you have no good mood. We call it's a kind of like you feel dull and unmotivated. So that's a different type of condition in your nervous system. So that's the second level of herbs. And then the third level is the most specific for that particular condition. In Ayurveda, there's always some herbs that's best for that condition. Like for Parkinson's, Mukunapurni is always used. We call it conch, Mukunapurni, and it's obviously one of the main ingredients there for the nerve pain formula. We got the ashwagandha in there for the overall nervous system. Dashamul, which is 10 herbs, again, overall for the nervous system. So you already got 11 herbs in there that are just for the nervous system. Nothing to do with the neuropathy yet. And then Yogaraj Gugulu is another formula made of 20 herbs that's used specifically for nerve pain. Now we're up to 30 herbs. And then we have conch, which is the Indian name of Mukunapurni, which is used for Parkinson's and trembling and nerve damage. And then we have two more herbs. Nirgundi. Nirgundi is just an analgesic herb. You could use it in any formula just for pain. So when you see the word pain there's going to be some analgesic herbs. In this case, they're in the nervous system. But if you had joint pain, we would have herbs for the joints, herbs to strengthen the joints, herbs to help joint pain. And the last herb here is tagar, which is like Indian valerian, which has a kind of also analgesic effect, but has an affinity to the nervous system and particularly the mind. So that's how these formulas are made. So this little formula here that's taking care of people's neuropathy and sciatica has a total of almost 35 herbs in it. And in each of the sets of herbs, there's really 3 sets of herbs, some for the nervous system, some for the pain, and some for the specific condition in this that we're dealing with here. Like the conch is very specific to like tremors and nerve damage. So we can go on with more examples. When we talk about, in Ayurveda, we don't do hormone replacement therapy. I mean, naturopaths do it. But in Ayurveda, we try to, support the reproductive system we'll talk about, say, the woman in this case. We have a hormonal imbalance. We don't just put on a estrogen patch and we're just totally ignoring her reproductive system. So, but when you say, I have estrogen imbalance, I'm low estrogen, I'm estrogen dominant. Well, what organ are we talking about? You're talking about your reproductive system. So the herbs need to support the reproductive system. What's one of the best Western herbs for the reproductive system? Raspberry leaf. So it doesn't matter what. And then for Ayurveda, probably Ashoka, Shatavari would be some of the best herbs. So the formula is going to be based on that. So we have a formula here, and it's called Female Balance, and it's for hormonal balance for the woman, and it's of course it has hormonal balancing herbs like Dong Quai, black cohosh, and red clover, and these are all like phytoestrogens. Besides black cohosh is more of a phytoprogesterone, but these are the ones focusing on estrogen. But then they also have a red raspberry leaf, which is just a uterine tonic. So it were just having some herbs just for the uterus. That's it, just for the uterus. And there's another herb. Spearmint is used to often help for women to lower testosterone. And Daminia is like a little bit of it's an aphrodisiac, both for men and women, slightly stimulating. And then there's also ashwagandha, which is balancing the adrenals. So it's not just, and it's not putting the estrogen in your body, the progesterone in your body. It's helping your reproductive system and your adrenals in this case to balance and to make the right amount of hormones. And these products are already proven effective. It's not like we made them up. Same for mood balance. We don't like to use the word depression, so we talk about mood balance, or this tea used to be called happy tea. So we know in the mind is, we have a mind. The mind is related to the mind, related to the nervous system. So one of the first herbs is Brahmi, which is one of the premier herbs for your mind and your memory. And it's also very calming, very soothing. And we have motherwort, which is also good for mood and hormonal balance. Daminia, very interesting. That aphrodisiac is again here because, this is try to be a happy tea and improve your mood. And there's a fine line between happy and horny. So, the horny man is the happy man, the old saying goes. So there's an aphrodisiac in the tea. Even people say, wow, I drink that mood balancing tea and God, I do feel good. I don't know what's in it, what's doing it. I always ask them, man, how's your libido? You feel like, oh yeah, I think it's helping my libido too. That's because I put aphrodisiacs in it. But see, you're not thinking, oh, I have depression and just jump on a medication. You could have a hormonal imbalance and not be producing enough hormones, sex hormones to keep your libido up. Your mind may not be stable. So we're stabilizing the mind, calming the mind. St. John's wort, of course, we know is for the mood, but it's also anti-inflammatory. It's also relaxing. St. John's wort is in here. That's a common herb. And it's slightly stimulating too, because the Daminia is stimulating. And black pepper also stimulating. So there's a little bit of a stimulating. Each of the herbs has a different job. And people say, well, how come that helps me with my depression? Well, it's all the herbs working together like a team. Some of them are helping with your hormones. Some are just kind of stimulating your mind. And some are, calming your mind. And then there's even peppermint. So it just tastes good. How could you be happy if the tea doesn't taste good? You have to think very deeply when you're treating somebody and understanding how the herbs are affecting that organ in the body, that system in the body. And that's what they are. That's what they're doing. And many people get very, very confused by these medical terms when, in fact, the condition is really not that complicated. Like I said in the beginning, fibromyalgia, it sounds complicated. I can't spell it to this day, but I can treat it. And many people who even have these conditions can't even pronounce the medical term. So I tell them, just forget the medical term. You have inflammation in your connective tissue. And more than likely, the inflammation isn't just there. They probably also have it in their joints. Just like somebody has inflammation in the colon, they probably got inflammation in the joints. Almost everybody who has like ulcerative colitis and they're inflamed in the colon. And their muscles are also inflamed. They just don't worry about that because it's not debilitating like, the inflammation in their colon. But you could always sum up the person is inflamed. I say that all the time. They've got gingivitis, they've got muscle pain, they've got arthritis, they've got endometriosis, they've got ulcerative colitis. So they think they have 3 or 4 major medical conditions. But in fact, they only have one thing: inflammation. It's just in different parts of the body. We could use another example. And those are all like pitta examples where there's inflammation. We could also use congestion. A person says, yeah, I'm constipated. I can't go. I have gallbladder pain. My head feels dull. I can't think. I can't get going in the morning. My legs are swelling. So what is that? It's all one thing. You're blocked up. You're congested. So, of course, once you know that this is your main issue, blockage, congestion, then you need to stop eating things that are blocking you up and congesting you. And people don't think like that. And just like if you have inflammation in your colon and your uterus and your gums and you have gingivitis and you think you got to go get a surgery, well, it's just inflammation in your gums is inflammation in your muscle. Your gums are basically muscle. So as long as you're having inflammatory things like coffee, chocolate, sugar, nightshades, well, I mean, all this isn't going to go away. Even with the herbs, you have to get rid of what's causing the inflammation in the first place. Same for blood sugar, of course, which is more obvious. You're not going to manage your blood sugar until you stop putting the sugar in your chai or your coffee and having all these little sugary snacks. I mean, it just isn't going to happen. Then the other category besides, so we have inflammation, that one's big. Congestion is big. And the next one, which people don't think about as much, and that's depletion. Now, the woman may come to me and she says, oh, I have degenerative bones. And I go, oh, what about your hair? Oh, yeah, my hair's falling out too. What about your fingernails? Oh, yeah, they're really brittle. And do you feel very strong? No. Let me see your muscles. Oh, they're weak. Oh, let me see your joints. Oh, you're all bony and you don't even have enough fat. Let me see the collarbone. Oh, there's big holes here. Probably your ribs are sticking out. And they go, yeah, okay. All of these things are one thing. You're depleted. Now, of course, what do you need to stop doing if you accept you're depleted? You have degenerative bones, your hair is falling out. I mean, these are kind of nutritional problems. Nutritional deficiency is depletion. Let's just put it all in the category. Sometimes people say, oh, I'm low in vitamin D. I'm low in vitamin B12. My hair is falling out. I got the scoliosis of the spine. I've got degenerative bone conditions. So they think they've got multiple things, but in fact, they just are depleted. So you have to stop all the things that are depleting you. Fasting, juicing, skipping meals, having celery juice, drinking coffee instead of meals, trying to lose weight. Oh, that's what those people are always doing. They don't equate the fact that their degenerative bone condition and them not eating, skipping meals, not having dairy, fasting all the time is making it worse. I always have to explain, how are you ever going to build those bones back, get your hair to grow back, strengthen up your muscles, be able to take out the trash, not feel so weak in the afternoon if you keep skipping meals and trying to lose weight. But, it's a tough job talking women into eating more. Tough job. Because, I feel better when I'm less weight. But no, you don't feel better. You told me you're tired every day in the afternoon and you need coffee. You're depleted. See? So you have to see it for what it is. Now, of course, you could have all three. You could have inflammation in the body. You could have congestion and blockage in the body. And you could have depletion in the body. All three could be going on. You could have some depletion some places. You could have inflammation other places. And you could have congestion other places. So we spoke about it in simple terms. But we need to break it down. We need to be able to break it down as where organs and systems is the inflammation. What systems is the blockage? What systems are depleted and not getting enough nutrients, maybe from poor digestion too. So this is how you need to look at your health issue, not the medical term. The medical term just scare you. Even if we go to cancer, if you have a growth cancer, what is it? It's a big giant growth growing inside you, in your colon, So you have a growth, something growing inside you. You don't want growing. Not all cancers are the same, but this is for this type of cancer where there's a tumor. So I said, what makes things grow in the body? Do you ever study nutrition? What makes the baby grow? What makes the cells grow? What makes them grow? Protein. So why are you having protein shakes when you have a tumor? Why are you having all that animal protein and meat when you have a tumor? You're trying to shrink it down. You're trying to dissolve the tumor. You don't want to keep eating all this protein and make your tumor keep growing. So that's why another good example, I could go on all day, giving examples of how you have to think in this practical sense, looking at where is the health problem, what organ is involved. And then you can take vitamins and herbs for that organ and system. That's always a good start. And then, of course, what is the issue with that organ? Is it depleted? What's a gallbladder? Gallbladder pain, what is it? It's just a clogged up gallbladder. It's blocked, just like your colon blocked. So you have a blocked gallbladder, then you're going to have gallbladder stones. So if you have blocked arteries, well, you know what that causes. So you have blockage. So there's many things you can be doing to create more blockages, like a lot of animal protein, a lot of snacking, excess weight, crackers, cookies, nuts, cheese, dairy, yogurt. They're all blocking. But if you're depleted and underweight and you have a degenerative bone condition, why are you vegan and fasting? You're trying to grow your bones back, trying to grow your hair back, trying to be stronger, and you're underweight. You need to be eating meat, particularly if you're anemic. Another type of depletion is anemia. Okay? Well, I hope that helped you. And if you do have a complex health condition with a big medical term, I would just sit down and try to understand what organs are involved and start trying to improve those organs. Try to improve that system with your food and your diet. That's a good start. And then, if somebody treats you like myself, we're going to focus on that organ and that system and its problem. Just like a car. You don't have fancy names for car problems. You got the water filter, you got the air filter, you got the fuel filter, you got the carburetor, you got all these different parts and they can go wrong. Same with the human body. It's a medical term, will only confuse you. Focus on what organ and system is being affected and what is its issue and what do you need to do. All right. Thank you very much, ladies and gentlemen. I do hope this inspired you and helped you to understand natural health care from this very clear perspective and not be overwhelmed and confused with medical terms. Thank you very much. God bless you all.